Okay, so I'm going to demonstrate how to do a sensory, a gross sensory check before you do any modality. This should be done before you do any type of modality with your patient. So there's a few steps we'll go through. So the first thing we've done, I've already introduced myself to the patient. Well, I will go through that. But you need to introduce yourself to your patient, tell them what you're going to do, and then you need to make sure that you expose the skin. You don't want to test sensation through clothing because it will be obscured. You always want to do it through skin. So as you can see here, I've already got my patient in a gown, draped, and I've got the skin that I need exposed. So for our scenario here, we're going to say that our patient's coming in today for upper trap tightness and upper back pain. So we're going to put a hot pack on him after our treatment, okay? So I'm going to start my session, and then you can follow along with the steps that I'm doing. And all these steps that I'm doing are on the skill comp form that is posted online, so you can follow along with that as you're practicing. Okay, hello, my name is Joseph Allen. I'm a physical therapist here. Can I get your name and date of birth?
Yes, it's George Sermon, November 16th, 1994.
Nice to meet you, George. Today what I'm going to do, I see you're coming in for some upper trap pain and some back pain. So I thought what we would do was would be to put a hot pack on your back to try to relax some of those muscles and get rid of some of the pain. But before we do that, I need to do some sensory testing to make sure this is a safe modality for you. Is that okay? That's going to involve me doing some touching on your skin, but I've got you covered up. I'm only going to touch you where I've got you opened up back here on your back. Is that okay?
Yes.
Okay. So the first step is going to be I'm going to inspect his skin integrity. So when you look for skin integrity, you're just looking for any open wounds, any cuts, any bruising, any excessive redness that doesn't look normal, any rashes, any bumps, anything that looks like the skin is not completely intact. So I'm looking at his back, his skin is intact, there's no cuts, no bruises, no rashes, so none of that is there, so that's good. So skin integrity is intact. And now I'm going to check his sharp and dull sensation, okay? So for this, I've taken a paper clip and I've straightened out one end so that it's sharp on one end, and I've left the other side curled so that it's dull. So what I'm going to do, I'm going to show him while on his arm or on a different body part, on an unaffected body part, so he'll know what to expect when I go to the problematic area. So David, this is the sharp and dull object. I'm sorry, George. And this is dull, and this is sharp. And that's what I'm gonna be doing on your back, okay? I'm also gonna test hot and cold sensation. So I'm gonna use this cup of ice, this ice massage cup, and I've taken a metal object and put it inside of a hot pack to warm it up. So that'll be our warm object, okay? So what we're gonna do, you can do sharp or dull or hot or cold first, it doesn't matter, but I just always start off with sharp and dull. You want to do that, try to do it bilaterally on both sides. You never want to do it on just one side. You want to try both sides. And you want to do things at least 5 or 6 times and to give him a chance to answer you correctly. So a normal sensation is considered 3 out of 5. 3 out of 5 trials correct would be normal. If it's less than 3, if he gets 3 or more incorrect, then that's considered abnormal sensation, so we would need to be cautious. And if he gets all of them wrong, then that would be complete loss of sensation, okay? All right, so let's start off with sharp and dull, so I'm gonna go ahead and start. So you ready, David? Okay, so what is this?
Dull.
Okay.
Sharp. Dull. Sharp. Dull. Sharp.
Okay, I think I did more than 5, but he got all those correct. So his sharp and dull sensation is intact also. So now I'm gonna do hot and cold. So David, here comes the hot, and just tell me hot or cold. So this one.
Cold. Hot. Cold. Hot. Hot. Cold. Cold.
Okay, so he was intact on hot and cold bilaterally. So his sensation checks out. For skin integrity is good, sharp and dull sensation is there, and hot and cold sensation is there. So he's passed all the tests. So now he's safe to do the modalities, which will be our hot pack. So now he's able to have the hot pack on, and then let's say that he's had the hot pack on. After the hot pack comes off, we need to check his skin integrity again, okay? So we should expect after a hot pack or a heating pad, the skin should be a little red, okay? So we're looking at that every 5 to 10 minutes while our patient has it. When we take it off, we're gonna inspect the skin again. If it's just a little red, that's okay, that's normal. You should tell your patient it's normal to stay for 20 minutes. If it stays longer than 20 minutes, you need to let your therapist know so we don't do that modality again. But David's skin is not red because we didn't put the hot pack on. You would also look for any blotchiness of the skin or anything, any color changes, any major temperature changes. Of course, after a hot pack, it's going to be warm in the area, but it shouldn't be too warm. It should just be a little bit warmer than the surrounding areas. So skin looks fine. So I'm going to cover David. I'm going to close his gown back up. And then we're going to continue on with our session. That's good.